All right, Jacob, thanks a lot. 622 now. Diseased or abnormal veins can lead to those unsightly spider veins and keep some people from showing off their legs. But it could also mean much worse problems than simply appearance. And cardiologist Dr. Craig Walker with the Cardiovascular Institute of the South is here to give us a few lessons on venous or venous diseases?
Venous.
Venous diseases. Doctor, I mean, spider veins are fairly common in a lot of people. When should they be worried about them?
Sure. You know, I tell people the venous side of the circulation is the forgotten side. We pay a lot of attention to arteries carrying blood down to the legs, but part of circulation or the circle is getting blood back to the heart, and that's what veins do. An early sign may be venous varicosities where the valves leak, and these can be unsightly at first, and that's not such a big issue. Later on, they often cause pain because of the stretch of the vessel, but where we really become concerned is when these become so big that they result in ulcers, or if clot forms within these veins and actually the clot breaks off and goes to the lungs. That is actually the second leading cause of sudden death in the United States.
If you see a spider vein, is that going to be a precursor to a blood clot?
No, not necessarily. It gives you an idea that the valves that occur in the vein are not necessarily functioning perfectly, but if it's not horrifically unsightly or causing pain, nothing needs to be done there. There are some basic precautions that one can take, such as simply elevating the leg each day to allow gravity to help better drain that leg. In the case of women, perhaps light support hose may help that. But the next grade up are bigger venous varicosities. That's a much bigger problem. Then as we get into the issue of clot, of course, in a deep vein, that becomes a very serious problem. If one develops a venous ulcer, typically on the lower aspect of the shin, typically on the inside surface, this often requires multiple hospitalizations. It's actually, believe it or not, one of the most expensive medical maladies that we have in America. So it's a huge problem once it occurs, very important to avoid, and luckily now we've got fantastic treatments for it. We can actually get rid of these veins that cause the problem. Anyone who's seen someone with a pressure sore understands that if you lay in a position for a long time and pressure from the outside pushes on tissue, it can erode that tissue, causing a pressure sore. Well, a venous ulcer is that in reverse. The pressure's coming from the vein inside, continuously pushing out, and that causes an ulcer. And so you can imagine why that would be painful and problematic.
Is the ulcer always visible on the skin, or might it be far beneath?
No. Typically, you would see the ulcer on the skin, and of course, the risks of the ulcer are not just that it's painful and ugly, but skin serves as the first barrier to infection. So once this is open, germs can easily get in. So this is also a big cause of death and disability.
How do you operate, if you don't mind, in a nutshell, on a spider vein? How do you correct that?
Spider veins are the easiest things of all to treat, because all we simply want to do is get rid of those veins. We have a deep venous system and veins that run under the skin, which we call superficial. They're right under the skin. So as long as the deep system's okay, we can just simply use a laser or other tools, put them on the spider veins, and in a matter of seconds, they're gone. You've simply ablated them. The deeper venous issues are a bigger problem.
Let's talk about the conference this weekend. You're one of the driving forces behind it. How many people are you bringing to town, and how are they enjoying New Orleans?
Well, we still have people showing up, so I don't have a final count, but it is over 2,000 now. We have people from every inhabited continent who are here attending.
And Doctor, how useful are these conferences? What sort of are you expecting to see any new techniques? Do some doctors bring innovations to the Big Easy when they come in for this conference?
The answer is not only do we expect to see some, we've already seen many. There are whole new technologies dealing with brand new ways of treating hypertension that are being shown live today from Germany, things that have never yet been done in the United States. We have shown techniques of how to save limbs in terms of arterial blockage. Today there will be many issues with venous disease and the evolving and new treatments of venous disease. So not only will there be, there has been, and every single day has been jam-packed with people addressing peripheral arterial and venous disease. There's an epidemic of this worldwide. It is a major healthcare concern. It's not gotten the attention it's needed in the past, and it is at this meeting, and there's a lot of excitement about the meeting.
Sounds great. Dr. Craig Walker with the Cardiovascular Institute. Please stress to the doctors the importance of hydration this hot weekend, and best luck with the conference, sir. Thank you so much for bringing this information to the table.
Thank you so much. Great to be here.
All right.